Assalamu alaikum. So this is the most important slide. Please read it carefully before asking questions. Okay. So this is a pulmonary medicine in a nutshell. Whenever we teach our PGs that whatever the cough is, shortness of breath is, you always deal with the airways and the parenchyma and the vasculatures and obviously the pleura. And this is where AI kicks in. So the concept of AI is that it's just a branch of computer science that aims to mimic like a human. You can see it kind of learns and thinks and like human. And in 5 years, we read a lot of books, as you can see. And all these books we read in 5 years can be fed to AI in a short period of time. So this is artificial intelligence. There's a machine learning, then there's a deep learning of the machine, and there's a complex neural network. This is just a cartoon, but talking to the computer guys, it just makes a lot of sense. So this is very simplified form of how the machine learning is done. And for example's sake, just in place of this plane, you can just put the UIP CT scan here, and the machine can learn to read UIP as quickly as possible. Then AI medicine has implications in diagnostics and obviously in therapeutics. And there are over 300 FDA-approved AI-based models in the market. These are the one in red that I've highlighted is the one which are FDA approved, and you can see the AI model can be used in the detection of lung nodules, in pulmonary embolism, in emphysema, and pneumothoraces. So image analysis is the most widely studied field in the AI. And as far as the chest is concerned, we use the chest X-ray and the CT scans, and the limits that we do is sky is the limit, I guess. So coming to the chest X-ray and the pneumothoraces, and with the AI, the pneumothoraces can be triaged sooner. So it acts like kind of a second eye, and so that we can do an early intervention in the tension pneumothorax. So this was a study done for the chest X-rays and the pneumothorax. And this was a retrospective diagnostic study, and it assessed the performance of AI in detecting pneumothoraces and tension pneumothoraces. And this model overall achieved a sensitivity of 80% plus. And this model is also the first FDA-cleared model that distinguishes tension pneumothorax from any pneumothorax. This is a meta-analysis just came last year, and basically what it found that the diagnostic performance of deep learning models was similar to that of physicians, but there were reports of bias in this study. Then there was another study which compared the chest X-ray and the AI, and this was a retrospective study, and it concluded that the current generation AI tools showed moderate to high sensitivity for detecting pneumonias, pneumothorax, and pleural effusions. This also showed that there were some more false positive findings, and their performance decreased for smaller size targets and when there were multiple targets. Then again, this was a multi-center trial done in India and USA, and basically what it showed that AI can help to identify many misfindings read by the doctors. And these were some of the misfindings: pulmonary nodules, you can see pneumonia, rib fractures, and the pneumothoraces. And these findings were detected by the AI, and the radiologists issued addenda to their report. Coming to the CT chest, in CT chest, the AI has implications. You can do the lung cancer screening, you can diffuse parenchymal lung diseases, and the pulmonary arterial hypertension. So this is a meta-analysis which came from China. And based on the results of this meta-analysis, the AI-assisted diagnostic system for CT imaging has a considerable diagnostic accuracy for lung cancer diagnosis. This is another study. This is Artery. This is the software used in the CT scan. And they did the multi-central, multi-reader retrospective study. And basically what it showed that by using this software, you can decrease the reporting variability, And also, it helps radiologists to detect more nodules. Diffuse parenchymal lung disease obviously is much difficult as compared to lung nodules or pneumothoraces because of their different patterns. So this is a study, one of the first studies, and basically what it showed that computer-aided diagnosis. When you use computer-aided diagnostic system, it was able to classify IPF with a similar accuracy to a human reader. This is how it is done. You can see here on the screen, the upper one is the IPF, the lower one is the non-IPF, and the IPF, you can see the orange part. Orange part is the reticulations, and the red part is your honeycombing, and below is your non-IPF, which is the ground glass. There was another study which quantified the fibrosis by the AI, and this fibrosis was validated by the thoracic radiologist. Then this is mind-boggling. This is, you can differentiate, using an AI, you can differentiate pulmonary arterial hypertension from pulmonary hypertension using non-contrast chest CT. And it showed, it was a cohort study, and it showed that AI was able to identify patients with pulmonary arterial hypertension, and in pulmonary arterial hypertension, patients had a significantly higher lung volumes, as you can see here. The figure C, you can see the pulmonary arterial hypertension, and here the diameters has arterial diameters from 1 millimeters to more than 2 millimeters as compared to one in the group 3. So just with the help of non-contrast CT, AI was able to detect pulmonary arterial hypertension. Okay, then coming to the PFTs, this was a study done, as it is not approved in USA, but it was a study done in Europe. In 120 chest physicians from 16 different European hospitals, read 50 cases with the PFT and clinical information, and resulted 6,000 studies. And the AI software examined the same data. And these are the results. You can see the pulmonologists are in the red, and the AI software is the green. And the AI software beaten pulmonologists in almost everything, except the only exception was this OBD. OBD stands for other pulmonary diseases like bronchiectasis, cystic fibrosis. Other than that, everything, COPD, neuromuscular disease, healthy patients, ILD, asthma, pulmonary vascular disease, and thoracic deformity, AI did better than the pulmonologist. This is another which is important to us. That is, the AI can be used for the diagnosis and for the drug-resistant prediction of pulmonary tube TB. And this is how basically it is done. You can feed in all the chest X-ray and the CT scan and the molecular data, and then you can come up with a program. I mean, this is not working now. Most of the studies are in favor, but AI can help to detect TB and also detection of multi-drug resistance. And this is AI in auscultation. So I mean, we all have been using the electronic stethoscope, but now there's a thing which is phonopulmonography, and then there's a dual microwave acoustic sensing. And this is what it is. Oh goodness. AI ne ye na kiya ki they can change. Never mind. So for the electronic stethoscope, what you can do is you can simply listen and amplify the sounds. But with the phonopulmonography, you can not only listen, but you can also record and analyze the sounds. But this analysis is limited to the sounds on the body surface. And the next step is the dual microwave acoustic sensing. It combines not only analyzing the sounds, but it also senses the deep tissue analysis, your blood flow and also your tissue properties. This is how it works. So you can have this phonopulmonogram on these sides, and then it will listen and analyze different breath sounds, tracheal breath sounds, or the vascular or bronchial breath sounds. And this will help with what? I mean, it will help with, number one, objective lung sound analysis. Number two, ease of remote and teleconsults, and obviously the cost issues will be less. And then this is assisted microwave dual sensors. Here you just put the sensor on the patient chest, and then it goes, the microwaves imaging goes to the receiver right there, and then they translate your breath sounds, they analyze the breath sounds, they analyze the deep tissues, blood flow, and then they come up with the diagnosis. Any infections, non-infections, anything is there. So AI in oncology, this was a survey done in the US recently, and it just showed that the people, they have 80% belief that the AI is helping in early detection and also in the treatment. And the same goes with the diabetes and the cardiovascular diseases. So this is how AI kind of works, or it will be working. That if you can take any example, you can take example of aspergilloma or any lung cancer. You do the chest X-ray, you do the CT scan, you do the biopsy, lobectomy, then you have the histopath, and then you have this molecular thing. And you get data from all the patients, and you feed it to the computer. And so the future is that the AI will see the chest X-ray, and he will have all the knowledge of CT scan and histopath, and this will be the end result. They will come up with the thing which is called a digital biopsy. Just looking at the chest X-ray, AI should be able to bring up a digital biopsy, a histopathology. And then finally, this is, we had a talk on robot bronchoscope, but this is an pilot bronchoscope robot. This means that all you need is maybe a medical student or a house officer who knows where the mouth is, and he has to put the stethoscope, the bronch in, and then everything will be done by the co-pilot. And it can engage, it is just a plug-and-play catheter, and it can go up to the 5th generation. So, this is just like normally when you do round, and by the end of rounds, you will say, just do the central line, do the dialysis catheter. Maybe one day you will be telling them, just do this bronch, do the biopsy, and you'll be all done. Thank you.
Thank you. Thank you.